Hi, I'm Dr. Alan Tan. I'm Associate Professor and GU Medical Oncologist at Vanderbilt University Medical Center in Nashville, Tennessee. I'm joined today here by my clinical genitourinary fellow, Dr. Zerey. Dr. Zerey, introduce yourself.
Hi, this is Dr. Mehmet Murat Zerey. I'm GU Fellow at Vanderbilt University Medical Center. I'm working with Dr. Alan Tan.
So together we did this collaboration at Vanderbilt looking at next personal DX as an ultrasensitive MRD assay. As you know, ctDNA is a big topic of discussion at these meetings, especially GU ASCO. We just saw this morning, Matt Galsky presented the B15 study that asked the question, did EV Pembro in the perioperative setting beat the standard of care of gemcitabine cisplatin? And what we saw was astounding, very much mimicking what we saw in Keynote 905. Pathologic complete response rate in the mid 50% range. And actually, if you went to surgery to have a repicocystectomy, the pass CR rate was actually close to 65%. But a big elephant in the room is, do these patients need the adjuvant therapy if they had a pass CR? We don't know currently the ctDNA status of these patients. And of course, there's comorbidities and toxicities associated with further Enfortumab Vedotin, such as peripheral neuropathy. So I think this poster that we put together in different settings, we had patients with perioperative MIBC, which you can see here, 7 out of 8 patients that had MIBC had EV Pembro on average in the neoadjuvant setting about 4 cycles. Median time to ctDNA clearance was 2 cycles, and 87% of patients cleared their ctDNA. But in the metastatic setting, I think that's a bigger question too. Can we de-escalate patients that have metastatic urothelial cancer getting Enfortumab Vedotin plus Pembrolizumab? In our study, we showed that 40% of patients cleared their ctDNA with EV Pembro at ultrasensitive levels of detection, down to 1 part per million. And the median time or median cycles of EV Pembro that it took to clear ctDNA was 3.5 cycles. So what does that tell us? I think we need to design studies that further answer the question, can we achieve the same outcomes as EV302 with de-escalation of EV, but maybe patients can continue pembrolizumab to get that durable remission. What we saw in EV103, 41.5% of people are alive at 5 years. So I think this is a major question that many people have in the field.